Welcome back. You're watching Ozarks tonight. I'm glad you're here again, and I'm David Oliver. Over the last year, the CDC has announced efforts to help put new resources out there to perhaps eradicate HIV and AIDS, possibly in the coming years. Missouri has been identified as one of those states that could use more resources in the fight against HIV and AIDS. We wanted to get more perspective on that and other issues pertaining to this topic locally. We've invited in our friend Lynn Meyercourt, who is the director of AIDS Project of the Ozarks, also known as APO. It's good to see you. I've not seen you forever, and I'm glad to have you here.
I am very happy to be here, David.
Before we get into the CDC and also some new medications that your clinic is using these days to help treat patients, let's remind our viewers what APO is all about and how it came to be.
APO has evolved quite a bit over the last 34 years. Started by grassroots folks that were concerned about their loved ones and friends basically coming home to die from the big cities. That's how it got started. And then more folks here in Springfield and the surrounding area began to get infected, and they were also getting sick and dying.
I took down some notes based on your history, and you all started back in '85. You had 2 employees at that time.
Yes.
Now, all these years later, you have 43 employees.
Actually, we're up to 53.
Up to 53 employees now, 600 plus patients served per year, 700 HIV tests per year. You all are staying very busy, obviously.
We're very busy, and unfortunately, we clearly need to update ourselves because we're up to about 1,500 HIV tests a year.
I've got these numbers off your website, so get on your website.
So yeah, I'll get on that. Believe me.
So it's gotten even more, obviously.
It's gotten even larger. And we're serving close to 850 clients a year with HIV. We've also opened up our services now to serve folks without HIV for primary care, hormone replacement therapy, and another service called PrEP, pre-exposure prophylaxis, which we can talk about a little bit later, which is huge in the prevention of transmitting HIV.
I know you all do a lot in terms of prevention education out there too, because your website, without the updated numbers, at that time said you were reaching about 10,000 people per year. I'm assuming it's probably more now.
That's probably pretty close, but that hasn't increased as much as some of the others. But we are certainly, between our main office on Glenstone and then our storefront downtown where we can test people on weekends, those numbers are growing. I
said to you before we went on the air, what's interesting is, I remember the 80s when we started hearing a lot about AIDS and HIV, and it was a topic on the news daily.
Yes.
And you just don't hear about it as much anymore. That doesn't mean we don't have people being infected, but you said it's because we don't have as many people dying. Right.
That's the main difference.
Yeah.
In 1996, medications came about that were able to stop the progression of HIV into AIDS, which is the disease that kills folks. And that has been a game changer. And I think some of the more recent research has shown us, as those medications continue to evolve, we can stop the transmission of HIV through those medications.
Yeah, when I called you and said, hey, you want to come over and talk, you said, well, yeah, we've got a lot of new medicines that are really showing some real promise now and helping with this fight. Talk about that.
The medications themselves, new ones are coming out regularly, but what we're finding is some of the meds that have been around for a little while, they can reduce a person's viral load. So that's the amount of HIV virus that's in your blood. They can reduce that to a point where you cannot transmit the virus. So you can't spread it through sexual contact. And that's huge. I think with that, as we get information out and more people get tested and more people get treated, we can realistically stop the spread of HIV. Now, it's not a cure, and that's very confusing for folks. You still have the virus in different parts of your body, in your organs and that kind of thing. But it's to a point that it's manageable where if I have HIV and I'm on medications, my viral load's suppressed, I cannot transmit the virus to someone else, and I can live a very long, healthy life because the virus isn't ravaging your body. There are still the best way to handle it is not to get infected because there are still damage that's done to the body just by virtue of having the HIV. And the medications have evolved quite a bit, but there's still some side effects to those.
When we talk about the CDC, perhaps allocating resources, dollars at the direction of the president to other areas in the country to try to perhaps eradicate HIV and AIDS, and we hear that Missouri identified as a state that could use more resources. What is your hope for that?
I was very pleased when the president announced in his State of the Union address that he wanted to eradicate HIV in this country by 2030. And there are plans that are now being developed with Center for Disease Control and Health Resources Services Administration. The HRSA is more the care end and CDC is more the prevention end, but there are some concentrated efforts there. And I think there are some real opportunities coming up in the future. Missouri was identified as one of 7 states, along with 48 cities in the country, where we need to target some resources. And that was by virtue of the rural infection rate in Missouri, being about 11%, that it's stayed steady or increased a little bit. And they want to target, the southern states also have been targeted. But I think there are some real possibilities here between the treatment availability and PrEP, which I mentioned earlier, pre-exposure prophylaxis. Someone can take that medication daily, and they're still doing research to see how often it's necessary. They can prevent themselves from being infected by HIV if they come into contact with someone who's positive.
And you're offering that locally?
Yes.
Okay, that's really groundbreaking information there.
It's a huge game changer.
We would have never dreamed of something like that years and years ago.
No, every time a new medication came out, I would be cautiously optimistic. Now I'm really optimistic.
Sure. Lynn, I'm going to put up your website, apo-ozarks.org, and your phone number, 881-1900. Folks want to get involved with you. Our time is getting away here, but what can people do to get involved with APO? People
can volunteer. People can learn about HIV and spread accurate information, because that's something that we all deal with every day, is a lot of misinformation about HIV and how it's spread. We know exactly how it's spread, and we know exactly how to prevent it and treat it now. Okay. Well, Lynn Meyercord with AIDS Project of the Ozarks. Obviously, this is good information to get out there. You heard the website there. You heard the phone number too. And thanks for what you do. And you're leading a large staff, obviously, and touching a lot of lives and helping people in our community. We're very fortunate to have the staff we do. All right, Lynn, I'm glad you came in. Thank you so much. We'll have more Ozarks tonight after this quick break.